Sorry guys, I'm having some difficulty syncing my recording with my slides because I use a Chromebook, which is not compatible with GoReact. So here's the video for my slide presentation on health literacy and COVID-19 vaccinations. First, we're going to start with an overview of Indonesia. The Republic of Indonesia is considered a developing nation due to its high infant mortality, low gross national income, its high poverty rate, and low life expectancy. Indonesia's population of 261 million people is mainly Muslim, with the Balinese population being mostly Hindu. Indonesia is comprised of a number of islands near South Asia, and the capital is Jakarta. Many different ethnicities have developed in Indonesia, and they all have different languages, histories, and cultures. There are 7 main concepts of the Indonesian culture. They are faith, courtesy, harmony, warmth, gentleness, filial piety, unity, and appeasement. Indonesia's general population has poor literacy regarding health. That happens because many people in that country avoid healthcare services, and this can worsen their health status. Studies have shown that there has been a provision of delayed or improper care to over half the population of Indonesia due to individuals not using health insurance and poor health literacy, preventing them from obtaining preventative and non-preventative services. Indonesia has been moving from a fee-for-service model to national health care during the last 5 years, spending over $27 billion US. There are private hospitals, but they are very expensive and most of the population cannot afford them. There are some benefits to the Indonesian universal healthcare model, access for the masses, an increased number of available facilities, increased funding for rural areas, and better access to emergency care. Some of the shortcomings are lack of pre-hospital services, poor education of staff in emergency departments, no systemic triage system to track patient flow, lack of access to emergency care, and differences in available finances in urban and rural areas. Identification of healthcare disparities. Indonesia is in the midst of a COVID-19 crisis currently. What has caused this surge? According to the United Nations, in July 2021, only 6 out of every 100 people in Indonesia had been vaccinated, with many of those not being vaccinated falling into the elderly and other vulnerable populations. One way the government has tried to speed up the process of vaccination is by sending out mobile health vans to hard-to-reach areas. Because so much of the population is spread out over multiple islands, there are difficulties in logistics, meaning it's hard to transport the vaccines to some of the remote locations, and there are limitations in infrastructure and storage for the vaccines. The World Bank has approved a $500 million US loan to Indonesia to be used to develop infrastructure, including COVID testing and tracing. In July of 2021, the US sent 3 million Moderna COVID-19 vaccinations to Indonesia to help with their vaccination plan. The PICO question that will be addressed is, does improving the health literacy of a medically underserved population increase the percentage of people who receive the COVID vaccination? Some of our functional definitions: health literacy is the ability of an individual to receive, process, and understand provided health information and make decisions about their health. The U.S. Department of Health and Human Services states that almost 9 out of 10 U.S. adults have low health literacy and are unable to manage their health and prevent disease. In Indonesia, only about 31% of the population have good health literacy. According to the Health Resource and Services Administration, a medically underserved population is a population that does not have enough primary care providers, has a high poverty rate, a high infant mortality rate, or a high percentage of elderly in their population. And all of these apply to Indonesia. Interprofessional approach. The U.S. developed the National Action Plan to Improve Health Literacy of 2010 with the aim of calling organizations and professionals to improve health literacy. Health literacy can involve almost any medical discipline. As nurses, we tend to work most closely with doctors or advanced practice providers, social workers, and providers of education. Some of the barriers to working with us, the other disciplines, may be structural barriers, such as infrastructure, things as space, time, and funding. There may also be cognitive barriers, differences of perspective, and a lack of awareness. The educator role can have an impact at many levels. Health literacy should start in young childhood. Educators in schools are placed in such a way that they can recognize and correct a student and the family member's health literacy deficits, starting when children are young, and educating the parents on the importance of immunization does help develop health literacy. A common barrier to high health literacy can be a poor relationship between a patient and the provider. Nurses can help overcome this barrier by providing a safe, welcoming environment where the patient can ask open-ended questions. This encourages trust in the relationship. How can doctors help improve health literacy? There is a developed tool that assesses the patient's ability to read and understand health information. This tool is called the Test of Functional Health Literacy in Adults. Physicians can use this tool to be better able to meet patients at the level they are at in their understanding. Physicians can also set goals to have a diverse staff, factor in health literacy into patient safety plans, and get feedback on understanding health information from the patients that use them. Stakeholders in this project include providers of care and the patients. The best way to gain support for change is to provide evidence that the change works. Showing providers research that proves that having higher health literacy increases compliance and decreases many health risks can encourage them to make the needed changes. Informing patients that good health literacy allows them to better navigate the healthcare system, find information out about their health condition, understand treatment options, and decide what the best option is for themselves. Having a plan that both providers and patients can follow when making changes is imperative. One barrier that you may encounter with patients is they don't want to reveal their ignorance. No one likes broadcasting that they don't understand something. Cultural beliefs may also provide a barrier between provider and patient. Cultural beliefs determine how individuals interact with their providers and how they do or do not follow treatment plans. Language may also be a barrier to health literacy. In many countries, the indigenous peoples may speak dialects that are not widely known. In the U.S., there are far fewer providers that speak a language other than English, but we do have a high population that only speak other languages. This can make education, which improves health literacy, very difficult. Some ways to overcome these barriers are using everyday language, following the teach-back method, and providing literature or printed materials at a third grade reading level. Funding and sustainability. While it has been known that low health literacy can cost country billions in emergency and inpatient care, there has not been a lot of research into how increasing health literacy can save money. A 2019 study found that by paying doctors to provide health education to their patients, a cost of about $15 per patient, there were savings of thousands of dollars per patient during the 5-year study. With the knowledge that there will be some upfront costs that will be mitigated by the savings that will come with implementation of the project, most providers and their organizations will be willing to use it once it is set up. Funding can be provided through government or state programs, as well as private organizations. Sustainability is fairly easy once the education program is set up and in place. The providers of all disciplines just have to use the tools provided to ensure the patient has the education needed to make good health decisions. Evaluation and analysis plan. There are a few ways to assess health literacy. There are some free tools available to providers that ask questions of the patient. One of these is called the Newest Vital Sign, the NVS. This tool asks the patient to read and answer 6 questions about an ice cream container nutrition label. This tool is available in English and Spanish currently. Other ways are to listen to the patient's excuses when they are asked to read or fill out forms. Patients saying things such as, "I don't have my glasses, I'll read it at home," or the inability to properly answer when being questioned about what they have read proves that they have poor health literacy. There are other established tools that can be used, such as the Test of Functional Health Literacy and the Rapid Estimate of Adult Literacy in Medicine. The Consumer Assessment of Healthcare Providers and Systems has also developed 3 surveys to evaluate health literacy. They are Clinicians 3.0, Group Survey, Health Plan Survey 5.0, and Hospital Survey. In Indonesia, they are currently using a short version of the EU questionnaire HLS TAC EU, TAC Q47, as the full form was found to be too time-consuming. Current issues driving the population in Indonesia are limited emergency healthcare access, the cost of healthcare access, the current difficulties with the transition from private care to universal health care, the lack of infrastructure to support these changes, and limited access to COVID-19 vaccinations. The COVID-19 impact on the locus of control for population health in Indonesia. Having a strong locus of control has a significant impact on health-seeking behaviors. A strong locus of control is positively related to vaccination intentions, meaning that people that feel like they are in control are more likely to receive vaccinations. COVID-19 has caused people to feel that they have lost their locus of control. In conclusion, low health literacy is a problem worldwide. Improvement is needed in all countries. There are several tools available to help providers identify patients with low health literacy, which allows them to properly educate the patient. With this knowledge, steps can be taken by all disciplines to identify and educate populations at risk for low health literacy. With proper teaching, individuals will be able to make smart decisions about their health care, including receiving the COVID-19 vaccine.